Join me, Terry Bradshaw, as I explore all that's new and exciting about the USA and Canada and what people are doing in order to make a difference. It's an easy way to see what's happening across your own country. Welcome to Today in America. As an NFL star running back, Minnesota Vikings Adrian Peterson knows a lot about perseverance. So when he suffered a knee injury that called for reconstructive surgery, it wasn't surprising to see him exhibit the same kind of determination off the field in rehab.
Coming off the ACL and then this MCL surgery, there was times that I was down. I didn't really want to, get out of bed and do anything. But just having that mindset that, hey, I want to get back. Not only do I want to come back stronger, but stronger than before.
Perseverance gives Adrian Peterson the necessary advantage in rehab, but his doctor also prescribed a special one-of-a-kind device.
I tried so many different devices, I can't remember them all. But the one I do remember is the flexionator and the extensionator. Bar none, the best product I've used. It really helped me with my extension and get my full range of motion back.
The devices were invented and developed by Atlanta orthopedist Dr. Thomas Branch.
In 1991, we had a number of patients who had a hard time recovering their knee flexion after an injury or after surgery. Many of these patients came from areas that were underserved by physical therapists. So we decided to come up with a device that the patient could take home with them that would allow the patient to recover their own knee flexion while at home.
Dr. Branch says over 10,000 patients were treated during the first 5 years with very good results and no complications and no safety issues. Over the years, improvements were made on the flexionator, and the company developed a new device called the extensionator. The extensionator was designed for the knee and for the elbow. The flexionator was designed for the knee and ankle and the shoulder.
The science behind how this works can be best demonstrated by the use of silly putty. Silly putty is a substance which is viscoelastic. That is to say, when you pull really slowly, it stretches. If you pull quickly, it breaks. The idea is the knee flexionator used at home 7 days a week, up to 8 or 9 times a day, will allow stretch to occur in the tough tissue around the knee without breaking tissue, which causes more bleeding and more damage.
For physicians, physical therapists, and patients desiring rapid, guaranteed results when conventional rehab methods fail, ERMI is a brand that they trust to treat more difficult and severe motion loss problems. Kevin Wilk is the Associate Clinical Director for Champion Sports Medicine in Birmingham, Alabama.
I like to recommend the ERMI device, particularly the extensionator, for my patients, is because it imparts a stretch that I think duplicates what I do in the clinic. It also imparts a stretch that I don't think the patient can accomplish on their own, in so much as the actual device captures the heel and the foot to prevent any type of rolling out or femoral rotation. The other nice part about the ERMI extensionator is the pad that goes over the distal thigh. It imparts a high force right near the joint line, so it's a very focal type of stretch, very much of what we're trying to do in the athletic training room as well as in the physical therapy clinic.
ERMI CEO Eugene Sung sees an even greater demand for these devices in the future.
The landscape is changing, and we're changing in order to meet it. We're committed to improving motion for disabled workers, veterans, elite athletes, everyday people, and seniors.